My name is Malon Paiva. I am an obstetrician gynecologist at one of the private hospitals in Port Moresby, Papua New Guinea. This was a unique opportunity to come over and join the border bicycle ministry to conduct an evangelism program here on the Indonesian side of the border. We went specifically to a village that's called Moso. It lies very close to the border, and in fact the people have relations across and land that extends right across the border to the Papua New Guinean side. Many of these people were born in Papua New Guinea and speak Pidgin very well as their first language, apart from their local language. So there was no language difficulty with communication. So it was a unique opportunity to come and perhaps conduct the first medical mission that the Border Bicycle Ministry has embarked on. So I count this a privilege and thank God for this opportunity to come and participate in this Border Bicycle Ministry program. So the village consists of about 50 households. Population would roughly be about 350 to perhaps 500 people that live in this area. We saw about 25 patients with various ailments extending from little sores and scabies, skin lesions, to malaria. There's a lot of mosquitoes here, and so malaria is very common. And there were about 4 patients we saw that had eye problems. They were elderly, so they suffered from cataracts, and so this needs attention. And so perhaps a bit later on, we made referrals, gave treatment wherever we could, and many of them were unable to seek treatment elsewhere because their clinic in their village is closed. They had a nurse who unfortunately passed away a few years ago, and so they have to seek medical treatment out of their location. The next one would probably be at the Batas market area, or they have to come down to Jayapura and other areas close by. Some of them actually mentioned that they prefer going back across to Vanimo to get treatment. There was a 73-year-old man who had an inguinal hernia. He had it repaired in Vanimo, but it apparently broke down, and so it's got a hernia on the left side. This needs surgical attention. So there was a 77-year-old who also had high blood pressure. So we've organized for him to have his high blood pressure medicines. There were a few gynecological problems as well, with women having bleeding issues. We saw some of them as well. So for the future, I envision a mission that might come with perhaps dental and ophthalmological services to provide to these people. And God willing, we can perhaps organize that and come to conduct this medical mission along the border areas of PNG and Indonesia. We've so far established a good relationship with them, and God has been good in bringing about this opportunity. And I'm very thankful that this might be the start of many more missions to come across to minister to the people at the border area. For those young people who have lots of energy, if you want to be part of this mission, that'd be a good thing, because through the medical ministry, which is the right arm of the gospel, when Jesus was here on this earth, he used his medical ministry as a way of gaining access into people's lives. He brought healing before he taught. So that's the principle we adopt as well in spreading the gospel message to people. meeting their physical needs before we tell them about what God is able to do for them in their lives.